I'm Melissa, one of the physical therapists at Rise Physical Therapy here in Fayetteville, and today I wanted to talk to you about plantar fasciitis, which is essentially inflammation of the connective tissue in the bottom of the foot, or the plantar fascia, which is usually caused by problems with ankle joint mobility. Could be some weakness in the smaller muscles in the foot that support your arch. Could be due to tight calves or prolonged standing or walking, like at your job. And it's a very common issue, and there are some exercises and strengthening things you can do at home to help with it. So if you're interested in that routine, just keep on watching. So as I mentioned in the intro, one of the contributing factors to plantar fasciitis is tightness in the ankle joint and the calf muscles, which can cause your foot to collapse more, and then that strains the plantar fasciitis on the bottom of the foot. So there are a couple of good stretches for that you can do at home to start relieving some symptoms and improve flexibility. So the first one, you would grab a spot on a wall. The affected foot goes behind you, that's the one that you're stretching, and then all you're going to do is bend your knee, keep your heel down, and then straighten your knee. So you should feel it pulling kind of down here through these tendons. You might feel it in the front of your ankle as well. All of that's normal. So I would do about 15 to 20 repetitions on that. Once you've done all of those, I would go ahead and go down again and hold that position, because now you're doing a soleus stretch, and the soleus is one of the muscles in the calf. So when you're doing a static stretch, you want to hold about 30 seconds, do about 3 of them. One of the other things that contributes to plantar fasciitis can be weakness in the supporting muscles in the arch of your foot. So I'm going to show you a couple of exercises that you can do at home to help strengthen those. So the first one is to do, I call them towel scrunches. You don't need to use a towel necessarily. You could just use your sock on like a hardwood floor. And so basically what you're doing is trying to kind of scrunch your toes up. Imagine that you're bunching up a towel using your toes. And so try to do at least 15 to 20 of them at a time. As you do that, you should start to feel it working kind of down here underneath the arch. To make it more challenging, you can stand on one foot and do that. Or if that's painful or too much, you can also just start sitting and do the exercise seated at first. And then the next one is called an arch lift. So similar to the last one, but actually what you're doing is imagining there's a string kind of underneath your inside arch of your foot, and it's lifting your arch up towards the ceiling. Try to hold for a couple of seconds and then relax. So you want to try to keep your whole foot and your toes in contact with the ground as you're doing that. You don't want to be doing that or doing that. Again, to make it more challenging, you can stand on one foot and do it. Or if that's too much or if it's painful, then just like the last one, go ahead and just try it sitting at first. So there's just one more calf muscle that we haven't stretched yet, which is the gastroc muscle. So for that, you're going to need a step or a curb, just something to hang your heel off of. So again, the affected foot is the one that you're stretching. So you're going to drop your heel down below the step and just hold that stretch for about 30 seconds. You should feel it kind of up in your calf muscle. If you need to, maybe do it by a step near a wall so you can hold on to something for balance, or if your balance is okay, you might not need it. So I would hold for 30 seconds, do 3 of those. So I hope you enjoyed that routine. I would recommend doing that 1 to 2 times a day initially. If you find that you're having more pain, or if your pain is not getting better, I would always recommend calling a physical therapist and just letting us assess you, because there are other treatments in clinics, such as soft tissue mobilization that we can do that can help kind of speed things along. So hope you enjoyed. Thanks for watching.